So I've worked in the NHS for over 10 years, as I mentioned, primarily as an orthopedic surgeon in that time, but I've also worked in other countries such as South Africa and Malawi. And my biggest bugbear has always been operational problems, which delay me and prevent me from treating patients. What do I mean by operational problems? Because it's quite a sort of broad and vague term. For me, it's things such as IT, estates and facilities, medical equipment, stock. Now, these are the things that I need to treat my patients and clinicians need every day to treat patients, but they go wrong all the time. And actually trying to get those things fixed can be really difficult. And the impact is massive. So I could probably write a book on all sorts of different reasons why I've cancelled an operation, from a light bulb in theatre being broken, not being able to print patient notes, not having the right, medical and orthopedic equipment actually turn up to theatre at the right time. So I founded MediShout because I realized digital technology is helping make the whole world more efficient in other industries. So why aren't we doing the same in healthcare? And what MediShout does is it's the only app that we know of in healthcare where staff can report any operational issue. So if you've got a problem with a certain bit of kit or estates and facilities or IT, you report the problem and we triage up to the right team or the right person at the right time. And then they can report back to you, keep you updated with what's happening with them fixing the problem. So you can actually manage your services much better. But now what we're moving more towards, and particularly with SBRI, is using the data to predict problems using artificial intelligence and machine learning algorithms. So if you can predict when your equipment's going to break, if you can predict the number of cases you might need to do in an orthopedic theatre, you can then make sure you have all the right resources at the right time. And that's really critical at the moment because the backlog of care is higher than it's ever been. It's absolutely huge. COVID has made a massive impact. And that's where ourselves and SBRI are hoping to sort of work together to really push our technology forward and help the NHS. But what this funding is going to do is take us to that next level, especially around evidence generation. So we know anecdotally our technology is having an impact, but what the funding will do is say, right, not only can MediShout have an impact, but it can really help reduce waiting lists or reduce the number of cancellations and really focus on the NHS's key challenges at the moment, which is really around elective recovery and the backlog of care. So it's kind of saying we have this really broad platform which does lots of things, but now let's target it on the thing that's impacting the NHS the most and use the SBRI funding to actually evidence this and then think about, well, how can we then scale it up to as many hospitals as possible? So we're obviously naturally confident we can achieve these things because we've already started to do it, but it's that extra level of evidence that we just need to prove now in the next 6 to 9 months. I mean, I see things as partnerships and I see this as, no different from any other partnership. And often before you enter a partnership, people promise the world and then sort of under-deliver. But with SBRI, it already seems like it's the opposite. So we didn't even know we'd have, lots of resources to help us. So we've got sort of project managers sort of making sure that we're staying aligned to our plans. We're being introduced to health economists to, help plan out what we're going to do with the data before we start to work with our own health economic team. So that's going to not only help reduce our costs, but it's just going to help the impact and value of what we deliver at the end. So it's not just saying, oh, well, go off and make it work. It really is nice to know that we've got really experienced people who've managed dozens, if not hundreds of similar projects to make sure that we are going to be a successful project at the end of this, because that's what we're all about. It's about impact. It's about making sure we make that difference. So you can never have enough help, especially when you're working in healthcare. We already have 2 types of feedback. I can log in now and I can see data of how many reports have been sent, and we can see in real time that the app's being used and jobs are being actually resolved and communications happening, and that's really really satisfying. But we have had health economic impact reports which show we could save NHS trusts over £1 million per annum efficiency savings. We've published data in journals to show that we improved PPE allocation at a hospital within Imperial College during the first wave of COVID. Publications to show we can save 15 minutes per staff member every single day. So we do have evidence that's built up and lots of different bits of evidence. I suppose the thing that we're focusing on now is really the next stage of evidence is really around our AI, and so predicting a lot of these faults before they even happen and impact your front line, but really thinking about we can physically prevent an operation getting cancelled, and therefore we can help the backlog of care. Because it's a big and ambitious aim to actually make, and it's sort of the holy grail of what the NHS is looking at the moment. So we have lots of evidence, lots of great feedback, lots of champions, and we're hoping now we're going to sort of tie this all together with a really sharp, pointy edge at the end of this project.